All right, good afternoon, everyone, and everyone joining us online. My name is Alberto Caban, and I'll be talking a little bit about total worker health. I'm really excited and pumped to talk about this topic, which is a very practical public health topic. Indulge me for the next couple of minutes as I take you through the lens of total worker health and how we can apply it to study cancer in the fire service. So I'm going to tell you a little bit about the background and the rationale for total worker health. I'll show you how it can be applied within the fire service and what are some opportunities for implementation within the fire service. So I want to make this a little bit interactive as possible, and I'll do this with the folks in the room. So how many do folks want to give a guess of what is the size of the general US population currently right now, documented and undocumented individuals in the United States? Okay, so it's estimated around 330 million individuals in the United States that are today. Do you know what the size of the US firefighter workforce is? Among those 330 or so million Americans, how many are firefighters? And people from the NFPA are not allowed to answer that question. Okay, so we have about 1.1 million individuals are estimated to make up the workforce of the United States for firefighters. So specifically, it's estimated to be about 1,056,000 in the year 2017. But what's interesting there is that not all firefighters are created equal, right? So we have very different groups of firefighters that make up this workforce. In fact, it's estimated that about 35% of that workforce is career professional firefighters. And some of our volunteer firefighters from Florida have reminded me that they also find volunteering to be a career. But around 35% make up the United States workforce as career professional. And the other 65% come from our volunteer body. It's estimated that about 7%, 8% is about women firefighters that make up that workforce. And half of our firefighter workforce in the United States is between 30 and 49. With approximately almost 30,000 fire departments around the US. I'm going to use today's example for total worker health by talking about our Florida firefighter workforce, which I'm most attuned to. So we have estimated around 70,000 career and volunteer firefighters in Florida, about 45,000 are career and 23,000 are volunteer fire departments. And you can see the distribution of the infrastructure between city, county, and fire departments in the table displayed below. So what approach do fire departments use to keep firefighters safe and healthy at work? What strategies do they use in order to maintain the health and safety of their workforce? And so traditionally, we look to occupational health and safety programs and different subgroups of those programs in order to address that question. So some of those components of a traditional occupational health and safety program can include training and supervision of all tiers of the ranks within the fire service. It could have a hazard identification program. It could maintain records and statistics of how injuries are happening within the fire service. It might monitor and follow up on different hazards that firefighters are exposed to throughout the career. But taken together, these elements, some more prominent than others, should be visible within the fire service infrastructure. When we look at occupational health and safety in the United States, it's been evolving over time. If you look on the left on this busy graph, what started originally as sort of a monodisciplinary, where folks would study some sort of disease that comes out of a worker group, and you fast forward to today, we now have become more multidisciplinary and trying to understand not just occupational health and safety, but also workplace health promotion. How can we use the work context to improve the health of the firefighters so they can leave as healthy as they started when they began their tenure? So if you look all the way on the right, closer to the 2000s, we start now looking at well-being at work. We use multidisciplinary approaches. We try to include health promotion within the workplace, improving both health and well-being and quality of life. And so if we look similarly at the evolution of health promotion programs within the workplace, there's been sort of these three pillars of how workplace health promotion beyond traditional occupational health and safety have evolved. So on your left, we start with traditional workplace health and wellness programs that have been sort of morale oriented, right? You could do it. You could get healthier if you focused on it. But unfortunately, it tends to have poor performance outcomes and not a lot of people participate in it. If you look all the way to the right, which is where we envision a more modern and integrated health and wellness program in an organization, it's very results oriented. right? So how much a percentage of your workforce has cardiovascular disease? How much of it has diabetes? How much of it has high blood pressure, right? And then you start adding different activities within the organizational structure to try to improve productivity, reduce risk, all integrated into one. So a little bit more high performance. Now, this is very interesting lens of trying to combine both occupational health and safety as well as workplace health promotion, because workforces change, right? That's the only thing that we can expect, that we will always have change. So if you look at the future of work in terms of hazards, we should always see the same type of persistent, exposures that we have traditionally in our workplace, but we have new ones that emerge, right? So COVID-19, how do we deal with that and adapt as a fire service to those changes? The other can be the employment. How many people are entering the fire service? Are people delaying their retirement, staying longer within the fire service? Are there competitions between different departments and taking their workers from one fire department over to another because the benefits are better on one than the other? The flexibility of work, right? How many days do you have to work, or can you have choices if you're trying to be a mom and raise kids with your spouse? What type of flexibility is available through that employment? And then from the workforce context, we think about issues like the aging workforce. If you have delayed retirement in working, we could expect to see maybe workers that have more chronic conditions come on board with more health-related issues. One of the challenges we have now is obesity, right? Even the younger workforce that comes in is already overweight and obese. So how do we support them in trying to achieve optimal health and safety? And also multi-generational. Right? So having different generations working side by side on a team effort, where maybe the older worker just doesn't see right with that younger firefighter that just started. I always hear the story of, well, we've always been doing it this way, so this is how we do it in the fire service, but how do you, the younger firefighters that are coming in and want to embrace and use more healthier approaches to health and safety, do so. And I think we have a unique opportunity in using the total worker health approach to do so. And I want to share with you the experience that we do here in Florida and at least how I see it. So safety, health, and well-being, I think, are intrinsically tied. So how we think about a firefighter's health and safety and ultimately their cancer experience can be tied to many different aspects of the work environment, including outside of the work environment. So for example, diet. Right? So you live at a fire station, and that's your family, and you eat there, but then you go home, and what type of diet, nutrition do you have there? Smoking. So what type of secondhand smoke or direct smoke exposure do you have beyond the smoke exposure you have as part of your, exposure there? Noise, right? There's many different sort of factors that we think about how are they interrelated between the work context and the home context that go together. So what is total worker health? So by definition, total worker health is defined as policies, programs, and practices that integrate protection from work-related safety and health hazards, looking at promotion and injury and illness prevention efforts. So in plain English, it's trying to integrate occupational health and safety with workplace health promotion. So how do we do that? So I'll tell you by first defining 3 important terms about the total worker health lens. The first is policies. So I want you to reflect in your mind for a minute. What are some of the policies that are inherent to your fire department? If we talk about cancer coverage or cancer screening, does your fire department cover cancer screening? Do you have an annual medical exam? Do you have a screening? Right? What are the policies in place? Like all the firefighters must undergo that. You may also have programs, and a program is a plan of action aimed at accomplishing a clear objective. So an example could be a program called the hood swap program, where your department actually swaps hoods to make sure that when they go back on service that they have a new clean hood ready for that exchange. The other lens for total worker health is the practices. So what do we do that's a behavior, right? The application of an idea, but it may not necessarily be written down as a policy or as a program that's done. It's just, everybody does it that way. So an example could be maybe leaving your dirty boots out in the Bay Area and not bringing them inside so you don't track, soot or contaminant throughout the workstation. It's not written as a policy, but we practice it because we want to keep everyone as clean as possible. And so total worker health is looking at our policies, programs, and practices together. So keep that in mind. The other important lens with total worker health is looking at things both from the worker level and at the organizational level. I'm often frustrated with leadership or an organization blaming the worker for not having been compliant with a certain policy or practice that made them susceptible to that disease or to that safety issue. When in reality, it's a shared partnership, right? The organization should also be invested in the health and well-being. So how does the programs, policies, and practices of the organization also protect ultimately from cancer development? And so from Total Worker Health, we'll be looking at both the worker level and the organizational level. So how did this all get started? Where did Total Worker Health come from? Somebody thought of it? So this was actually an inherent program within the Center for Disease Control, which started as a work-life balance for employees at the CDC. So in 2011, June, just around this time, 10 years ago, NIOSH launched officially the Total Worker Health Program that seeks to recognize different technologies, working conditions, and emerging forms of employment that can potentially impact worker safety, health, and well-being. Unfortunately, this lens hasn't been applied a lot to the fire service, and I think we have a lot to learn and think about by using a Total Worker Health lens. Again, remember, we're trying to integrate traditional occupational health and safety defined by health protection with practices, programs, and policies of workplace health promotion defined as health promotion. So for you nerds that took calculus, we want to integrate the top and the bottom here on what's going on. So if you reflect on your workplace health, if you're your fire department, you think about maybe some of the different policies, programs, and practices that align with health and safety issues. So a fire department may have an EAP, a third-party vendor that maybe provides mental health services. The fire department will clearly have a health insurance program with their county or municipality. There might be some form of an occupational safety and health program that they, aligns to NFPA standards. There may be a workers' compensation program available within the county or the state that supports that. But oftentimes these programs are not integrated. They don't talk to each other, right? So how many times have you had a worker that got injured, but then they have to be, shuttled between many of these different components of it? And so Total Worker Health is seeking to be able to integrate these traditional aspects of occupational health and safety with health promotion. And so again, the goal is integration of all these aspects together. So Total Worker Health looks at a couple of different lenses, and I apologize, this slide is small, but it's just to show you a 37,000-foot view of all the different ways you can apply Total Worker Health to a fire department. So if we think about, for example, control of hazards and exposures, you can use organizational level and worker level aspects of control to look at chemicals, physical agents, biological agents, the traditional occupational health and safety. But you can also look at the organization of work. Can you change the workflow of how the firefighters are doing something within their shift, within their station, within the department in order to improve the health outcome of interest, right? How can we reduce that cancer? You can look at the built environment, right? Do we have the proper HVAC? Is air that's circulating that may be poor in one area, transferring dirty, contaminated air to another? Total Worker Health asks us to look at leadership, right? And leadership at all tiers within the organization, from our young rookie pro-B firefighters that are emerging, wanting to rise in the ranks, to our more seasoned, mature firefighters that may be set in their traditional ways of doing something, but we can maybe change them to think about it in different ways. And so taken together, you can see that there's a lot of opportunities to apply this framework to the firefighter environment. I want to show you just some really three concrete examples that NIOSH shares with us on Total Worker Health approaches. So let's say in your fire department you have high smoking rates, that maybe 20% of the workforce actually smokes. So you could combine conversations on respiratory protection, how we use SCBA, with smoking cessation in a respectful and confidential way so that it doesn't necessarily highlight somebody who's a smoker, but yet gets the conversation going about, maybe we do have a tobacco issue going on. Maybe we are vaping or chewing too much within our service. A second example can be hearing conservation. So if we think about all the loud noises that firefighters are exposed to on and off the scene, going home to a loud household or being in a incident response that has a lot of loud noises. What about the opportunity about having a conversation about hearing conservation and testing ourselves annually to make sure we're not having hearing loss, to then talking about what are some of the loud structures within the fire station that maybe we can adapt through engineering controls to try to reduce some of those loud sounds. And the third example, which affects all workers, including our firefighters, is musculoskeletal disorders, right? So how do we prevent, for example, osteoarthritis within this workforce? Is it possible to have discussions about ergonomics? So when we're doing patient handling and move them on the gurney from one location to another, we can also talk about arthritis management. Like, yeah, your knee creaks, but how is that related also to the way that you're lifting patients, right? And we sort of integrate those conversations together into one. So we actually did an experiment 3 years ago in Florida to the question that our firefighters brought to us about, well, it's too expensive to start a cancer screening program for us. We just can't afford it. It's expensive and we don't have the expertise to do so. So we surveyed about 30% of the Florida Fire Service. So this is just a convenient sample. But we actually looked at multiple factors using the total worker health lens to understand what influences a fire department in being to implement a cancer screening activity. And this was very broad. It could be skin cancer, talking about colorectal cancer screening. And so our analysis showed that there's really 3 primary factors that influence the implementation of a cancer screening activity within a fire department among this sample of departments. And one is having an occupational safety and health program present, one that's updated regularly through committee meetings, and then one that has a written OSH policy statement. So it really didn't matter whether any of the other factors within the lens of total worker were present. We're really just shaping the OSH program, influence the using of it. So in order to get these estimates, you need data, right, to show like what's going on within your fire department. And I wanted to show you one way that we look at the total worker health through the lens of existing data. So we created what's called the Florida Firefighter Chart Book. This allows us to estimate the health status of our Florida firefighter community. And so one of the things we do is we take data that's collected as part of an online system called BRFSS. So at the state level, the CDC administers a survey to all to a selected sample of Floridians, and we are able to classify them into the job type that they're in. After we classify them into their job type, we further pull out the firefighters that are within their job type and compare their health status to those of other Florida workers. So in this analysis, we pooled different years of data, BRFSS 13, 15 to 17, and you can see our sample had about 33,094 workers, which estimates to be about 6.5 million workers of the Florida workforce. So we pulled out our firefighters from that sample and started to compare analysis. And I'll highlight some of the things that we found in this study. So no surprise, a lot of the trends here at the state match what we see at the national level. So for example, in terms of gender, 9% of the female workforce, 9% of the workforce is female in the state of Florida. The greatest proportion is within those that are 40 to 59-year-olds. So we have a more mature Florida workforce. About 58% are white, 81% report some high school education, and then about 80% report being married or cohabitating with an individual partner. So from there, we pull out the health conditions and say, okay, what is the health status of our Florida firefighters? And so you can see here that each color represents a disease type, so cardiovascular disease, skin cancer, other types of cancer, depression, and kidney disease. And we can break it down by different lenses, so we can look at by the age group. So does this affect our older or younger firefighters? You can see those firefighters that are greater than 60 self-report more cardiovascular disease and skin cancer, right? And so we see a lot of skin cancer here in Florida. And when you stratify it by marital status, similarly, you can see differences in the reporting of chronic diseases there. We also see them by gender. So you can see that our women firefighter report a little bit more skin cancer, the proportion there, as well as through education and as well as through race. Now, when we compare our Florida firefighters to the other workers in the state of Florida, what do we see and what do we learn? So we see that this is the distribution of disease across all workers, and I'll highlight for you what we see in our Florida firefighters. So skin cancer is elevated. And one of the things that we've been working, thanks to our state fire marshal and our health and safety collaborative and others around the state, is improving decontamination procedures, right? How do we change those policies, programs, and practices within a department to try to improve decon? Because we know that many of the exposures within the fire service, like polyaromatic hydrocarbons, can contribute to some of these diseases beyond being the Sunshine State. Because I know many of you say we're in the Sunshine State. So is it UV exposure as well? We can also compare different rates of asthma, depression, arthritis, and diabetes. So for example, if we look at our firefighters, you can see they actually have less prevalence of self-reported asthma, depression, arthritis, and diabetes. This could be skewed. Remember, this is self-reported data that, if they feel confident enough to report the information within a survey. But usually you have to be healthy to work, and particularly our firefighter workforce has to be healthier. So we expect to see slightly lower rates when compared to the general population. Similarly, when looking at alcohol and physical activity use, so a risky behavior, right? Something that you may want to have a discussion about in the fire service, we see that about 87% of our firefighters don't meet physical activity requirements, despite it being a physically demanding job, and about 27% of our firefighters report engagement in different alcohol consumption. And then when we look at smoking rates, interestingly in Florida, we have very low smoking rates. The BRFSS, independent of some of our other cohort data, has showed that smoking tends to be lower at 1.8% within the overall workforce. And then similarly, when we look at overweight and obesity, you can see our firefighters seem to show a slightly higher rate of the proportion of people that are in the overweight or obese category. So diet and nutrition, another lens of total worker health. How do we have conversations about integrating diet and nutrition within the fire service and improving exercising and giving policies that support the ability to exercise while one is on shift? Right? And so we look at health insurance coverage within our firefighter workforce in Florida, and you can see that mostly everybody has health insurance, with just 1% that don't report health insurance. So there is an opportunity to make sure that we leverage healthcare access and utilization with their providers. So when we look at the distribution of health status, like how does firefighters report their health? So their overall health status for those here in Florida, you can see about a quarter of the population that are white collar, 26 report excellent health. And then when we look at our firefighters, which has the largest, about 35% report excellent health. And so you can compare health insurance status, visit with a primary care physician within the last 12 months, and then, or identifying with a healthcare physician, and then a last checkup, where you can see some variation in the percentage of the workforce that's visiting a doctor or considers that they visited a doctor. So we can use this chart book and using this data to be able to, as a starting point, identify opportunities for total worker health in the workplace. What are some of the areas that we can begin? We see variations, for example, in the prevalence of skin cancer within our Florida firefighters. So what type of conversations can we have within the department at the organizational level and at the worker level to be able to improve some of these risk behaviors or health conditions? So one strategy for total worker health is using the traditional hierarchy of control, but apply it to the total worker health lens. So in this view, we can talk about first stages is to eliminate. Are there opportunities to eliminate some of the working conditions that impact safety, health, and well-being within the workplace, followed by substitution? Is there a way of substituting a particular hazard or behavior or approach that is contributing to that health disease, using engineering controls and redesigning? Doing education, and then support and encouragement of that change personally within the department. So then you may be curious, so where do I start? This sounds like a lot, and where do I begin if I wanted to start with my fire department? So one way to start with your fire department is I recommend using the CDC scorecard. A first step could be begin with a total worker health committee. Select maybe 2 to 3 firefighters and different tenures of the workstation that are wanting to be able to use this lens to describe the health status of the workforce. Make sure you secure top leadership support to be able to do this. Try to see if you can get a dedicated health and safety officer to serve on this role. Then you want to grab the CDC health and scorecard. Now, I'm going to show really quick how the scorecard can be applied in the fire department. This is what we call in traditional public health a needs assessment. How can you say that you need something if you don't show the numbers about what's going on within that fire department? And then summarize the scorecard and share it so we can all see what's going on. So the CDC has what's called a worksite health scorecard. It's very generic, and there's opportunities for adaptation within the fire service. But it tests all these different domains. The number next to the word means how many questions are asked in that particular domain. So there's about 25 questions assessing organizational support for the workers. There's questions assessing high blood pressure, high cholesterol, physical activity, and so on. Even questions on sleep and fatigue that can be asked within the workforce of the department. So the questions are very simple to administer. It's on a PDF. You print it out and ask your coworkers in the workforce to fill it out. Each of the questions are unique. It's answered with a basic yes or no question, and the responses get a numerical value on there. So for example, if you look at the questions on organizational support, I realize this may be a little small, but you can see that they ask directed questions about the experience of that individual firefighter there on the fire scene. When you're done, you can use the scorecard to then evaluate different strategic interventions that could be done to address that. For example, if we're seeing issues around smoking or drinking or sleeping, that could be adapted and applied within that particular fire department. And conversations can start at the station level or at the whole fire department level. It doesn't have to be a very large endeavor to begin with. But the idea is that we evaluate the policies, programs, and practices that are ultimately contributing to health and safety issues, particularly cancer control. So it's important to start with a group that's concentrated and passionate, wanting to do that. For example, us here in Florida, we use the FACE team and the Health and Safety Collaborative, who through their spirit, passion, and engagement with the firefighter workforce help us to look at these topics in the different levels. I wanted to leave you with, in my last slide, to tell you we've been using the total worker health approach to study skin exposure assessment. How do we control for skin cancer? We see it very high in the fire service. And so we've been doing studies looking at ultraviolet light, looking at aromatic hydrocarbon exposures. And so with our firefighter partners, Captain Hughes and Chief Bader, we've put together a paper that sort of walks through how we can think about controlling skin cancer exposures using the total worker health approach in the fire service. And I encourage you to access this paper. It's free. That sort of walks through sort of our thought process on how to apply this within the fire service. And if you're really nerdy and want to learn a lot about total worker health, NIOSH has published a textbook on total worker health that explains a lot of the literature and motivation for wanting to look at things at the organizational level and the worker level. So thank you for your time, and I'm happy to answer any questions about this framework for the fire service.
Thank you, Alberto. This was really important, and thank you for sharing with everybody. So to start off, I want to know, what are some challenges that you foresee in implementing total worker health in a department?
Yeah, some of the challenges of here locally is trying to understand what it means. I think folks traditionally think about just the occupational health and safety program, and we have activities going on there. But the notion of implementing a health promotion program and collecting that collectively and integrating it can be daunting. Where do you start? Where do you begin with it? And I found just doing something as simple as a survey and administering it, understanding what's going on, it starts the conversation about looking at it.
Great. And we got a question from the audience. Is there an app to collect this info for the fire department? Is the only option hard copy?
Well, as far as I know, and if there's anybody from the CDC online, please correct me, but the survey instruments are available on PDF online. I don't know that there's an actual app to electronically collect it, but you can always, use Qualtrics or SurveyMonkey and put the questions on there for collection.
Great. And then you mentioned the study on skin cancer and implementing total worker health. Can you talk about anything, the challenges putting that together and what your experience has been in real life of implementing total worker health?
Yeah, so I think in the area of skin cancer control and prevention, we think about skin cancer screening. How many of you all have a skin cancer test once a year with your doctor, that they look you up from head to tail and tell you, okay, this is particularly something to follow up on, right? So how do you integrate conversations about skin cancer screening with decontamination procedures to remind them, like, we don't know, we should be checking those things, and how do you implement that within the fire service? One of the things we do in our paper is sort of walk through each of the lenses of total worker health to try to explain how you can use some of those different domains to look at the integration for safety and health, and doing decon procedures with the health promotion and trying to get the screening out to the workforce.
Great. And I see we have a question from the audience.
Yes, a couple of things. I think that total worker health has been a nuanced thing. I think that at the very first, some of us worried a little bit that it would actually detract from emphasis on occupational risk factors. Turned out that it's had something of a much better effect than we feared. And one of them is to clarify the interaction of risk factors. For example, the smoking rates. Some of the lowest smoking rates I've ever seen around the world are in Australian firefighters. Levels of 10%, 5%, and so forth. So when you get statistical studies of a group like that, you're approaching an unconfounded, relatively pure exposure situation, which is very useful to know, and you wouldn't know that unless you did a smoking survey. I think that many times outcomes, especially in cancer, that are casually dismissed as being smoking related are done so through ignorance, because that kind of information isn't available. And it also applies to body mass index. Firefighters often, not always by any means, but often have lean body mass that's bigger than projected without adiposity. It's the adiposity that carries the cancer risk. And in the absence of any information like that, when we simply use body mass index, we're skewing the numbers and making things look worse than they actually are in terms of cancer risk. The final point I wanted to make was that the exposome is the exposure scientist's shorthand for all the various things that happen to your body that they can figure out had a trace back to some exposure. And the ultimate goal, of course, is to be able to reconstruct what a person has had over their life by looking at the traces in the human body. Well, total worker health becomes critically important there, because the exposome and what is currently in the human body is everything. So you need to know what the non-occupational exposure is in order to be able to subtract it. And you need to know what the non-occupational exposures are in order to figure out what the interactions are with exposure. So I think it really has added additional dimensions to our conventional occupational health approach.
Yeah, I very much appreciate your comment, Dr. Gotti, because I feel the same way in terms of like the total exposome and how we need to be, even from life course approach in terms of understanding how within utero, when we were in mom, all of that in its totality ultimately impacts the health outcomes that we're studying. I really appreciate this lens of total worker health, as a sort of a budding scientist, to try to be able to look at all of this in its totality, because oftentimes we just focus on like that one chemical and the one outcome, when reality, a human is exposed to so many things, even if you have a second job, right? So that second job is also exposing you to other things that may be contributing to it. So I appreciate that, and thank you.
Do we have any other questions from the audience? No? Okay. Well, thank you, Dr. Caban. I hope everyone here takes everything that you presented and implements total worker health in your department.